No, it doesn't.
I'll begin here.
Yes, I know. There wasn't urgent messages went out.
So, good afternoon, ladies and gentlemen, councillors and our guests. It is 12:45 on Monday, the 20th of November 2023, and this is the second of our two additional, or you could say special meetings this year to discuss urgent and important items of business. Can I apologise to everyone, including our guests, for the delayed start, not helped by the closure of a number of roads trying to get here. But we are in Newcastle, and I think it's really important for us to be in Newcastle because we're a health committee taking into account the health of all residents across Staffordshire. And this is an issue that particularly, not solely, but particularly affects the residents of Newcastle, and it was important to be here. So thank you to Simon Tagg and his team for extending the invitation to be here today. This is Staffordshire's Health and Care Overview and Scrutiny Committee, and we are here following the Environment Agency's admission that the monitoring data, particularly of hydrogen sulphide for the mobile monitoring stations at Wally's Quarry in Silverdale, since 2017 has been incorrectly calibrated. That means that the monitoring data that we are scrutinising with the Health Protection Agency, now the UK Health Security Agency, which we did back in 2021, July 2021, was incorrect. And the impacts on health assessed at the time may not have been accurate. I emphasise the word may not have been accurate. So the objective of today's session is to take the feed from the relevant professionals to make that assessment against assessment again based on the new evidence available. So just to be clear, the Environment Agency is responsible for collecting and sharing the monitoring data, while the UK Health Security Agency is responsible for interpreting the data as to its impacts on health. There are two different roles and two different government departmental bodies. We have seen previously both at committee because there is a symbiotic link between the two. Can I make one other comment in relation to the work that has been undertaken previously, that we need to look at and understand the impacts on the wider public's health, but also the impact on young people's health and well-being, especially if there are going to be longer term impacts. And secondly, the impact on those people who are more vulnerable with, say, respiratory conditions. As I say, we are in Newcastle under Lyme again, and thank you for the invitation from the Borough Council. And we have extended an invitation to Newcastle's Health Committee, that's their Health, Wellbeing and Environment Committee, to join us today. And that's so that they can join at the end with questioning, and I would ask them just to hold back any questions they've got till committee has gone through first. And I will try and bring you in if you can indicate, please. Can I also remind committee to focus their questions on health grounds or the process to get a better understanding of health matters, please? And so welcome to our guests and councillors. I am your chair, County Councillor Jeremy Pert. Let's get down to business. So can I remind you that today's meeting is being broadcast live by the magic of technology back through Stafford and out onto the web. And for those of you who want to watch it back today, the recording can be found on the County Council's website. The meeting is also being beamed live for those people who want to be involved, and will cut off 20 seconds after the equipment has stopped. All voting committee members are in person, and there is a variety of people who are joining us online as our subject matter experts, our expert witnesses. So could I ask our guests, when we come to the agenda itself, to accept that members have read and digested the papers provided, and as a result, can I ask that you restrict your comments to, say, a maximum of 10 minutes, please? And can we focus on the tangible outcomes for residents in Staffordshire using the data available at our disposal to sharpen the quality of debate and scrutiny, so that we can provide assurance and reassurance that things within the health and care system in Staffordshire are going in the right direction and the direction we want to see for our residents. So if we can bring the wider experiences to help triangulate as widely as possible, I'd be grateful, please. So on to our agenda proper. Apologies.
Good afternoon, Chairman. I've received apologies from Councillor Charlotte Atkins, Phil Hewitt, Thomas J, Kath Perry, Bernard Peters, Ian Wilkes, John Jones, Leona Lung and David Williams.
Thank you. They are noted. So declarations of interest. Does anyone have any declarations specifically related to Wally's Quarry that they want to, or the Environment Agency or the HSA they want to register? I'm getting no indications, so that's fine. So on to health impacts, item 3, health impacts of Wally's Quarry landfill site in Silverdale.
Mr. Chairman, apologies for the interruption, but are you saying that the Environment Agent were invited, whatever reason have chosen not to attend?
Yes, the Environment Agency were invited, and as you can see, they're not with us online today or with us in person.
I thought that you indicated that the base data is supplied by the Environment Agency and that it was the monitoring equipment that was not recording correctly, and that falls within the Environment Agency remit. Did we make every effort to get the Environment Agency to attend, or are they just unwell at the last minute?
You're absolutely right, Councillor, that we took every opportunity to invite and to get members of the Environment Agency to attend this public meeting. It is the Environment Agency's responsibility to collect the data, and as far as I'm concerned, it was their responsibility to come to a forum where community leaders can effectively question them and scrutinise the issue in more detail. They have chosen, for whatever reason, to not do that. We would, I'm sure, want to have asked a range of questions. For example, we might have wanted to know whether there were other monitoring sites that were equally affected in Staffordshire, well, maybe England, and whether they were similarly affected. I would also like to know what their internal auditing processes were over the past 6 years, since 2017, and how this situation went on for as long as it did. And finally, I'm sure one of the questions that councillors would have wanted to know the answer to the question of is how did this go on for so long, and how can the general public trust a body that has used data to reassure them and then found that it is wrong? In my view, all of this has gone without public scrutiny when the general public has been complaining about the smell coming from Wally's Quarry for years. For example, there have been 2,200 complaints of smell in 1 week alone last year. So we have tried every opportunity and every avenue, including writing to the Secretary of State for the Environment, Therese Coffey, and copying the Chief Executive of the Environment Agency, and also writing to the Minister responsible for landfill, Rebecca Powell.
Chairman, may I just come back in? That's the case. Would it be appropriate for the committee to see the correspondence?
I'm more than happy to release those letters publicly later today. And the real question is what we should do about the Environment Agency's non-attendance today, because as we described earlier, they have a fundamental role to play with informing this committee about the health impacts coming from Wally's Quarry. I would suggest that we leave that discussion till the end of today's meeting, once we've heard from the UK Health Security Agency. And maybe we might want to consider what questions we would have posed to the Environment Agency, and maybe we could frame those questions, but maybe we should actually write to the Secretary of State for Health, where we have a statutory role to refer stuff to. But I'll leave that committee to think about as we go. But clearly, we are not in a good place because one of the key partners should be around the table, and for whatever reason, they have chosen not to be. Okay, so let's move to those people who are with us. UKHSA. Would you like to start off this afternoon? Thank you for attending. I do appreciate that. A bit of a weird time as well to attend, so thank you for attending. Would you like to start off by introducing yourselves so everyone in Newcastle and watching online has that the understanding as to who you are and your roles? And then would you like just to take 5 or 10 minutes just to take us through the pack of paper that you've provided in the usual way, please?
Yeah, good afternoon. Shall I kick off? Thank you very much for inviting us. I'm Katie Spence. I'm the Regional Deputy Director for UKHSA in the West Midlands. And we've been supporting with this incident, as you know, for a considerable period of time now. I'll let my colleagues introduce themselves. Alec?
Yeah, thank you, Katie. Thank you, Chair. Thank you, Committee. My name's Alec Dobney. I'm the Regional Head for the Environmental Hazards and Emergencies Department of the UKHSA.
Great, thank you. Will?
Good afternoon, everyone. My name is Will Proto. I'm a consultant in health protection. I work with UKHSA in the West Midlands.
Thanks, Will. And Steve is on, although I know he has to disappear in about 5 minutes. Steve, do you just want to introduce yourself?
Yeah, good afternoon all. I'm Steve Barlow, Public Health Registrar, currently on placement with UK Health Security Agency.
Thank you.
Thank you.
Okay, I think we decided we would probably want to do a bit of an overview for yourselves, if that would be helpful. And I'm going to pass over to Alec to kick that off.
Yeah, thank you, Katie. And again, thank you, Chair and Committee. I've got a few slides to share with you, and hopefully the committee's had opportunity, as the Chair has mentioned, to peruse the current August risk assessment undertaken by UKHSA. Just to reiterate that the UKHSA, since the last time that we presented at the Health Scrutiny Committee, have undertaken a monthly risk assessment based on the data that's been provided to us by the Environment Agency. And until very recently, that data was showing quite a significant improvement. In fact, the data was below the reference concentration value for long-term health, so guideline value that we've been using for quite considerable time now, and data on a monthly basis was below that level. So for us, things had improved quite substantially. As we know now, on the 5th of October, that certainty has been impacted by a calibration issue highlighted by the Environment Agency, and that has certainly impacted our risk assessment and the way in which we do set out our risk assessment, because that is actually based on the data itself. So I've got a few slides just to highlight some of the key issues in our risk assessment this month, in the August risk assessment, because things have changed quite substantially. And I must say at this point that this information only relates to the hydrogen sulfide data. Data for all the other pollutants of concern remains unchanged in our risk assessment. So, due to issues with calibration of the monitoring equipment, the historic hydrogen sulfide data within UKHSA monthly risk assessment now has a greater degree of uncertainty. And for that case, there is no reference now in the August risk assessment to that data, so that historic data that we've had. And due to that historic data, at this time, we can only qualitatively assess the human health risk assessment. And that's based on a theoretical basis, assuming that the local population may have been exposed to levels of hydrogen sulfide above the long-term health-based guidance value, one that I've just mentioned, prior to September 2023. And that goes back to the time where the Environment Agency had started to monitor at Wallis Quarry landfill site, I think, and this campaign's back to 2016, 17, 18, 19, and then the subsequent issues that we had in March 2021, where levels were significantly higher. Now we are aware that the Environment Agency, along with DEFRA and their Chief Scientific Officer, are looking at those calibrated data sets, and we are waiting for their deliberations and conclusions about whether any of that recast data can be used for our risk assessment. But at the moment, we can only do a risk assessment based on the information that we have. And at the moment, as I say, that is qualitatively and theoretical. However, we can make some assumptions based around that qualitative assessment. And the first thing I think it's important to say is that back in March 2021, when levels were significantly higher, and they were the highest concentrations at that time, then the data as it was at that time was compared against a number of acute exposure guideline values. We call these EAGLES. And there are 3 values from EAGLES 1 through to 3. And it was only the EAGLES 1 value that was compromised at that time. And a compromise of that value, once exposure has been reduced, would mean that people shouldn't be affected any further by that concentration. Or is to be concerned about longer term or a significant impact on health, then we would expect levels to have reached an EAGLES 2 value, and that would have been a factor of 50 times higher. Very extremely unlikely that levels would have reached that time. So we can say with some level of certainty that only EAGLES 1 values were contravened at that time. So therefore, the long-term or serious long-lasting effects is unlikely to have happened, extremely unlikely to have happened. But obviously, we cannot currently rely on the historic data to assess the risk to people's health at the moment. So that's based on the actual numbers of the data. That said, the risk of long-term health problems is likely to be small. What we can't do is rule out any of those impacts at the moment. And we are acutely aware that people in the local environment and local population are still being affected by some levels of concentration in that area. And for us, this is the statement that we've placed in our risk assessment every month since the inception of this problem, that we expect all appropriate measures continue to be taken to reduce the off-site odours from the landfill site and to reduce the health impacts experienced by those in the local population. Thank you, Chair.
Thank you. Are we moving over through into questioning? Is that where you want us to go to next?
That would be super. Yeah, we'd appreciate that. Thank you.
I'm getting a few nods. So who would like to start? Okay. So on that basis, let me start. Oh, you ready?
Do a few things.
Okay. You didn't indicate.
No, I thought I had with my eyes, but never mind. These things grow up. Anyway, obviously I was involved in the first committee meeting we had here in Newcastle to look at what was going on back in 2021. My concern is that unless you have other information that we haven't been presented today, there's still no direct analysis in terms of the variation in the errors that may have occurred in the information over the years. And that does worry me because obviously when it comes to the international figures of 35 days and things like that, when peaks are over and therefore we need to take more immediate action and all the rest of it, as I dare say you would have done if that information had been with you and indicated such. I'll just keep it simple to that question. What is being done for us to be able to understand the elements of the error that might be involved with this? Have we got any idea of the size indication of how many more days these levels would have been over sort of world health limits of irritants and all the rest of it, and how far short they were of this 50 times factor? Have you got any indication at all? So I'll leave it at that question first, I think.
Thank you.
It's a very good question, and the answer is no, we don't. I mean, we are waiting upon DEFRA and the Environment Agency and the Chief Scientific Officer, who has set up a group of experts to look at the calibration data. And there's instrument experts there that will look at that data and then get back to us with a level of whether that data can still be used, whether that data can be used with a level of uncertainty within the data, or whether in fact that data can't be used at all. And until we get that information from DEFRA, we'd just be making assumptions on the data, on the numbers, and we're not prepared to do that. So we can look at some qualitative issues around complaints levels, but as far as the data, we're not prepared to do that.
Right, so following on from that, my question there is why DEFRA, when yourselves and the Environment Agency, I think, are in a better place to understand the information that's coming forward? I don't know whether that's true or not, particularly with public health. And I just wondered why it is that no indication to you has been given yet, and it's been since August that this information was known, that there was some errors within this, and we're now in October. It does seem to be taking quite an awful lot of time, and a question through the chair, if I can, is that if we don't have that information, and we don't know, therefore, the health impact on the people that live around the quarry, and those people that even might be passing through the quarry if they're in the area for more than an hour or two, what do we do now in terms of the health committee here, in terms of scrutiny? So those two questions, I think, and then I'll leave it for others. I've got others later on. So.
I can certainly answer the first of those two questions. Because of the nature of the problem that the Environment Agency has fallen upon, it is an instrument issue. It's a mechanism of the way in which the instrument and the calibration curves are used within those instruments as to whether or not that data can be retrieved and used. That's outside of the expertise of, I would imagine, the Environment Agency, but certainly out of the expertise and remit of the UK HSA. So we would not be able or have the expertise in-house to be able to do that. It needs an expert committee or group of people that have that knowledge and that competence, and DEFRA, as far as I'm aware, have pulled a group of people together who have that expertise, and they are, as we speak, deliberating that issue at the moment. So until they report, so we can't make an assessment of any data at the moment.
And just so I'm clear, I think I understood, just as another piece of information, that effectively DEFRA is independent, acting in an independent capacity of outside of the Environment Agency. Is that correct?
As far as I'm aware, yes.
I must say, I think that's poor. I really do. You know, I mean, I know that you analyse the risk assessments and everything else in relation to public health, but what's the Environment Agency using equipment they don't understand? I just find that extremely poor. So I'll leave it there, Chair, and they haven't answered the question about what this committee does until we get such information or indication, so we then can also, with the agency here, actually assess the risk to the public.
Yeah.
Chair, if I could just interject and add to that second part of the question, because I think it's important. We have undertaken a risk assessment based on a qualitative and theoretical approach to this. In some respects, it's if we have risks that have no data, we still have an opportunity to do some form of risk assessment, and that's the approach we've taken in the interregnum. So there is data here. There is a situation here where there was some exposure prior to 2021, March 2021, where the level of complaints had been elevated, but there is no data for that. So there are times where we do have to do a risk assessment where there is no actual data, and obviously we do the best that we can with when that's the circumstance.
Thank you, Jill Hood.
Thank you, Chairman. In view of the concerns about the accuracy of the data that we've been hearing about, how can we as a scrutiny committee be confident that other pollutants are being measured accurately? And have we had anything fed back to us yet about, I hesitate to use the word surge, but I would imagine that we've got members of the public who've heard about the inaccuracy of and the competency of the measurements. And I imagine that possibly they've got symptoms which they will attribute to the failures of the measurements. And it is really worrying. You know, human beings would maybe at this very point be imagining all sorts of things, and we can't give them any answers. Thank you, Chairman.
Who's picking that up, please? Alec?
Yeah, it is difficult, and we do appreciate that. That's why we have put in an interim risk assessment to give an overarching assessment of where we feel the risk is at the moment. And as I say, if I just repeat, in our risk assessment, we do say that we feel that the long-term risk to health is still low. We still recognise that people are impacted by short-term exposure to odours and to levels, certainly when they are transient. And we do have data that's current now, which we believe to be correct. So there is an ongoing risk assessment being undertaken each month based on corrected calibration data and corrected instruments. But again, the calibration of those instruments is a responsibility of the Environment Agency, both the hydrogen sulfide monitors, but also the rest of their instruments. And it really is for the Environment Agency to demonstrate that they have good governance in place to ensure that all of their equipment is maintained and calibrated correctly.
Thank you, Chairman.
So Alec, are you saying that there isn't an independent assessment of the other pollutants, which because we've got one set of people, the Environment Agency, who gave us some data which we now found out was wrong. How do we know that the data on the other pollutants and the assessment that is being made on those within your paper, and I'm certainly not questioning the UK HSA's accuracy on this, but how do we know that the assessments that you're making on the other pollutants is right?
Again, the Environment Agency should have independent auditors of the way in which they calibrate all of their equipment. As far as I'm aware, that is the case, and that's how this issue was found in the first place. So we must take from that all of the other instruments and calibration is correct at this time.
And these independent auditors took 6 years to find out that the existing equipment wasn't calibrated correctly.
Again, that's for the Environment Agency to respond to.
Yeah, I accept that, but I'm just picking up the train of the discussion. Thank you. I think we had Janice first.
Yeah, thank you very much, Chair. A number of my questions relate back to the empty chair. So it's very difficult, I think, because a lot of the questions that I've got lead back to the same route as what that one just did. And certainly the first one that I got on here is how can we be certain that this is only the one? And for routine audits, then I'd like to know what the definition of routine is, because I think in 6 years there's something gone very much amiss on that part. On the UK HSA side of things, I checked my notes from the meeting that came to back in 21 here, and I'd put a note aside on there saying section 4 of the report states the figures as a guide identified by the WHO. The levels of hydrogen sulfide in particular being reported at this site are significantly and consistently over those levels at times, and now we know those figures aren't correct. I'm pleased to hear your confidence and, well, I say recognising the uncertainty, but also the low risk, because we spent an awful lot of time at that meeting a couple of years ago looking at the effects on people's mental health and their well-being, not just the physical side, because we know from some of the harrowing stories that we were listening to at that point how it was affecting them on their day-to-day lives. And I put down a note saying that this is pretty much relentless. Now, to be at the point whereby there is that uncertainty that's being cast over it, I think that information about the low risk will mitigate against some of that, but it certainly won't take it away from those people who've got young children who are complaining of significant health issues. So my first question on there really is how are we supporting the community on the same basis as what we did previously? So again, we can make sure that anybody who is tuning in at this point or will hear it will be able to access some of that support. And if I can also just add another question onto that specific one, at the bottom of page 5, we've got some notes on the rectified data aspects. And I think, as well as the fact that some uncertainty is there over the fact that the calibration of the equipment wasn't being done properly, that we've also got inherent factors that might be coming around from power supply failure, hardware failure. Do you have any idea of how that might be impacting the data, or is that another question that again that goes back to our empty chair? Thank you.
Katie, we can't hear you.
Can't hear you.
Yep, you are there.
Can you hear
Yeah,
me now?
perfect.
Okay.
Yes.
Okay,
you.
thank you. I was just coming on the first point about the question on the health impacts, because I think that is obviously absolutely critical to this conversation, which is we've heard many times from yourselves, from members of the community, about the impact that this has had on them over the years. And just to absolutely agree really with the point that this needs to be recognised as not just physical impacts, but very much the mental health and wellbeing impacts that this has had. As we all know, the local NHS services did set up a specific mental health support service during a period of this time, and also around the recent announcement of the calibration issues, the local ICB also set up albeit a short term, but a health helpline for local residents, which I think does demonstrate the commitment from our partners to look at what more support can be made available. I think it's although we absolutely all recognise that we have now this uncertainty around the historical data, I think it is true to say that overall since March 21 the trend has been one of improvement, but clearly continuing to monitor that is going to be very important, and there is no doubt that we expect to see there continue to be some small peaks, particularly over some of the winter months, as we have every winter. So I think it's really clear to me that we still need to recognise the impact this is having on the community, and that individuals will each experience that impact potentially very differently. When we came to some of the community engagement events that have been held in Newcastle, we were really struck by, just within one single household, different members of that household report different symptoms, and that does demonstrate how this can be quite an individualized experience for people. So I think we are working very closely with our NHS partners in the local area, and I think it is something that we still continue to say very clearly, that measures must continue to be made on site to do everything we can to mitigate those impacts.
Thanks, Katie. And just to come back on the second part of the question, which was around the issues about power supplies and failures, I would just say in regard to that, field monitoring is quite difficult, and there will always be from time to time failures of equipment, normally short term, where power supplies fail, power cuts, pumps fail, instruments fail, and again it's for the Environment Agency to have operations and methods and procedures in place to swap out pieces of instruments to make sure that there's a continuation of that data flow to ourselves. And looking back over the monitoring campaigns that have happened, that's normally been the case.
Janice.
If I could just quickly come back, it may be a question that you might be able to help from your experience or redirect over to the Environment Agency, but would you be normally expecting a level of tolerance then between the data that you're receiving, and would that be of any significance in its own capacity?
No, that shouldn't be, no. There'll always be a slight difference between the sensitivity of equipment if one instrument's swapped out for another one, but in the round and over the monthly concentrations, there shouldn't be a huge difference now.
And then final question, if I may, Chair. We've got two statements from both of the bodies on there about timescales. Is there any chance of any type of indication? Is it weeks? Is it months? Is it years that we might be looking at being able to ascertain from what we've already got, and to have a position whereby we might have some more certainty?
Who's picking that up? Alec, is that you? Or
yes, I can certainly pick that one up again. So there's a meeting diaried in with the Chief Scientific Officer in December. That's when the group is coming back together, having looked at the data. I'm going along to that meeting as an observer from UKHSA. I won't be participating in that meeting because, again, we want to keep a level of independence because we just want to use the data. But of course, we want to, if there's a discussion about how the data could be used, obviously we need to be aware of that. So once we know that, hopefully we'll be able to, at least we can plan ahead then for how we might be able to interpret that data.
okay, thank you. Do you know, just on sorry, do you want to?
No, you carry on.
Just in terms of what, if that meeting is in December, when are we going to actually have some real information? Because it does strike me that this was known about on the 1st of September. I don't, and obviously some of this relates to the Environment Agency, so I'm just going to be really careful because it does not relate to the UK HSA. But you know, this was known about on the 1st of September. It was publicly made available on the 5th of October. I'm not sure what happened in those 5 weeks. We're now on the 20th of November. Time still is marching, and we're talking about a meeting in December, and you know, this feels like, you know, how long's a piece of string?
I think if anything, it probably speaks to the complexity of what's needed to be undertaken to determine whether or not this data can be used. That's all I can probably say. I'm not been party to the conversations, nor to that data. That's what we can, you know, we can take from the work that's been undertaken, and just reiterate that there may be no guarantee that that data can be usable at the end of that process. So we have to be prepared for both outcomes. One, data that can either be used or used with a level of uncertainty, or data that may now be completely void since its inception.
Understand. Thank you. Angela.
Thank you very much, Chairman. Good morning, everyone. Yes, I think you've answered part of my question, actually. This has been a major problem for such a long time, and people's health has suffered because of it, and their mental health, which, as Janice has already touched on. But I'd like to know, how are you going to monitor this moving forward as to people, how they're, you know, developing with the problems they've got? You know, and I would like to think, Chairman, that we keep this on our agenda for the coming years to come, actually, until we've got some positive feedback from this. Thank you. So really the question is, how are we going to monitor this, and what help is available moving forward, especially with mental health as well? Thank you.
Alec.
I was just wondering, is that a question that Richard or Katie might want to pick up? I mean, as far as the monitoring is concerned, the Environment Agency have corrected their analyzers for hydrogen sulfide. They've calibrated them correctly to the operator's instructions, and we will now, from September, use that information to continue to do our risk assessment. What we can't do is, at the moment, is stitch the new data with or marry that with the old data, because the old data is the data of uncertainty at the moment. But we can certainly look at new sets of data that's properly calibrated, and we can do a risk assessment against that. It will be shorter term, but at least we'll be able to see what the levels are and compare those to the standards that we have at the moment.
Yeah, I think Anne's question was probably looking at the health impacts, i.e., you know, those people presenting in 5 years' time.
Yeah.
And I think that was the question where Anne was trying to get to, I think.
Yeah, you're right. Thank you.
So we just, so we'll take Richard first if we can, and then I'll come to you, Katie.
Sure.
Thanks.
So there's been some analysis done to look at whether any of the data that's routinely available shows any signals of health effects from exposure to Wally's quarry. So we've used a range of routinely available data, including deaths data, hospitalizations data, GP prescribing data, and we've also looked at GP consultations as well, and tried to look at whether there's any sign that there's higher rates of disease and death in residents living closer to Wally's quarry than residents living further away. So far, that data hasn't shown any effect. And the limitation of it is that it's using routinely available data sets that aren't necessarily enumerated in a way that's a direct proxy. So, for example, the deaths data is enumerated at ward level, and so you can sort of fit the wards in terms of proximity to Wally's quarry, but it's not a perfect fit, if you see what I mean.
Yeah.
You look at the plume. There are some wards that are obviously affected, and some that are sort of partially affected, but the ward boundaries don't correspond precisely to that plume area, if you can imagine that. Okay. Similarly, if you look at general practice data, and so there are some general practices closer that you would expect generally serve that population. But you know yourselves that some people have GPs that live close to them, some people choose to live with a GP a bit further away. So again, those GP populations don't necessarily fit to the populations that we know has been exposed. Similarly, hospitalisations as well. So we normally expect that hospitalisations would pop up with stroke. The trouble with that is that there are so many hospitalisations for so many different things that picking out any effect from Molly's quarry is a bit like trying to find a needle in a haystack.
Yeah.
So I think we can, on the one hand, we can be partially reassured, because if there had been a huge effect, it would probably have shown up by now. I suppose the less reassuring thing is that if there are effects a long time in the future, obviously they won't have appeared yet, and also that data cannot rule out an impact at individual level. It can only ever pick up impacts at population level, and will probably only ever pick up impacts if they're pretty significant at population level. So it gives, I guess, reassurance at some level that there hasn't been a huge catastrophic effect, because I think we would have noticed it. But it cannot by any means exclude impacts on individuals, families, small groups. Now we could repeat that analysis, but it would come with the same limitations and caveats at any point that we did it.
Probably more because people won't.
Thank you. Just let's take Katie first, and then Anne, if you want to come back.
Yeah, I think Richard said a lot of it. I think clearly we have looked at a whole range of indicators, as Richard talks about, and of course we will absolutely continue to do that. And I think this just talks to Alex's earlier point that whilst we may not have the data, historic data at this point that we are able to talk to, we are looking to talk to those other sources of data, be it data through complaints, previous information that came through the symptom tracker, and most of that, in fact, if all of that did track very well to the trend, even if we don't have the specific data levels. So that gives us still like that useful insight moving forward. Just to talk a little bit though about the point around and what is the advice to the system to support the local community, and we continue to issue our advice, the public health advice to the community, although again at a very generic level around how to manage when there is a increase in odour. But also I'm very aware that the local NHS has continued to support and will continue to support that local community concerns that people will no doubt be accessing their local general practice around.
Oh, you've got mute again, unfortunately. We lost your last sentence.
Okay, so hopefully you can hear me again. So I think we are going to continue absolutely to work with those local system providers to look at what more can be done to support within that local community. But it clearly has been a significant impact physically and mentally, as we've said before.
Thank you, Anne.
Thank you, Chairman. Just to say, you know, this committee keeps it on the radar, actually on our radar. Thank you.
Janice, do you want to come in?
It was just a quick reply back to Dr. Carling earlier on, was just to say the analysis that you've mentioned there, appreciate the caveats that you've put on as well. But when was that actually done? Because you mentioned about the possibility of doing it again, and I just wondered what the time difference would realistically be from when it was done first time to potentially the second one. Thank you.
Last time I did it was last autumn.
Last autumn.
Okay, thank you.
Thank you.
Thank you.
Three little things from my perspective at the moment. In terms of the ongoing situation, many of these issues probably won't show up, if at all, because of the spread of data, the fact people leave and migrate and all the rest of it. So how much longer do you think would have to be concerned about the potential long-term health issues? Because that seems to be the one thing that we can't really be that certain about.
Yeah, so I mean, if I just try and explain how I understand the situation at the moment. So first of all, the question, has it had an impact on people's health? The answer is yes. And we know that because they've told us. So we know that when levels of hydrogen sulfide are high, that people have reported all sorts of symptoms: stinging eyes, sore throat, difficulty breathing, And they've also reported mental health problems, so stress, depression, anxiety, difficulty sleeping, and all the things you'd expect, actually. And it remains really important that odour from that site is reduced, both in terms of intensity and frequency, because the more frequent the problem is, and the worse it is, the more those people living close to the site will experience difficulty. The more difficult question is this one about serious long-term health effects that are directly attributable to hydrogen sulfide emissions. So I think now that we've hopefully got the instruments calibrated properly and we can be confident in the data coming from them, the data that we're getting post-September does not give huge cause for concern. So the levels are down. They're not down as far as we'd like them, but they're down within the parameters where we'd expect any long-term risk to health to be very low. And they need to stay that way and actually come down further, so we're not seeing as many reports of odour. We also know from Alex, what Alex told us, that even the worst single spike probably hasn't had any long-term physical health effects, because it would have had to have been 50 times worse at its peakiest. Now, is it plausible that the calibration was out by a factor of 50? Can't say definitely not, but probably not very likely. However, the problem for residents living close to it is it wasn't one big peak. This has been a cumulative exposure over a period of, well, at least since late 2020, and then before that, probably not quite as bad. So you've got kind of a 3-year exposure, sometimes worse than others. And the question is, to what extent does that cumulative exposure pose a long-term risk to physical health? When we thought we had data, the answer to that question was, couldn't exclude it entirely, but again, we thought the risk was very low. Now we don't have data, so we can't really do a reliable risk assessment. The question is whether the EA can adjust that data by saying, for example, if the machine measured a number 10, then actually it would have been 15. And so you get a completely new set of numbers, but they're just all a bit higher or a bit lower. My understanding is that might be difficult to do because the calibration error wasn't necessarily predictable. So each individual reading might not be consistently out by the same number, a factor of 2 or a half or whatever. And that is why, A, I think it's taking a bit of time, and B, it may not be possible to produce that data at all. In which case we're left with at least a 3-year period with cumulatively high levels of hydrogen sulfide, but we don't really know how high they've been, which makes the question, to what extent does that pose a risk to long-term human health, quite difficult to answer, actually. So I think we're hoping that we can come up with some reliable method to adjust that data to give us a basis for risk assessment. But if that's not possible, we're then into trying to answer that question from a position where we haven't got any physical data to actually rely on. And that will prove something of a challenge, I think. I'm sure UKHSA colleagues will do their best. But I think if we get into that position, that may be the next question for this committee.
Thank you.
So, yes, thank you very much. Very, very good question and answer to the question. Obviously, I'm looking at the current data now, which we have been given today. The confidence in that, I assume from your answer and from the others here, that is now being considered as being accurate. And even that on MMF1, that still gives up to 15, 16 days above the required normal level of 7 micrograms parts per million sort of thing, per metre squared, per metre cubed, sorry, I've got that wrong. And it's 87% of the 8.7% of the monitoring period. My concern is that we've had this sort of data going back 3 or 4 years. If we can't adjust it, then we'll never know what it is that people have been exposed to, or rather what level they can be exposed for in terms of, I agree with you that the peaks are very unlikely to be more than 50 times greater. My concern is the number of peaks that now exceed that required level. It could be an awful lot more over a much longer period of time, and thus the long-term, this is why, follow up my question before, the long-term health issues might be something that we're not at all aware of and may not even see for a decade or more. So that's my concern on that front. And bearing all that in mind, the removal of MMF6 monitoring system, which was done back in June, I think it was, June or July. I don't know whether that may have even triggered the whole issue about the monitoring system, whether it was decommissioned and they realised it wasn't being correctly monitored at the time. I don't know. That's just a pure guess on my part. Would you wish potentially over the coming year or so to actually increase the monitoring stations to make sure that the data that's now being trundled out there is accurate, or is that data's gone and the idea of putting in more monitoring is just a bit of a waste of time and we just keep to those 3 that are there at the moment? And that's to both.
So that's probably ultimately a question for the EA, because they're the ones doing the environmental monitoring.
But in your thoughts in general?
Maybe we should let the EA answer some of that question.
No, but it's just, I think the health implications is what I'm interested in.
I think certainly from a health perspective, given how difficult and traumatic this has been over the last few years, we would want to see some ongoing hydrogen sulfide monitoring for the foreseeable future, so that we can be confident that levels have genuinely come down and are staying down. The exact number and location of monitors, I think, is something for discussion with the EA, but I think we would certainly want some environmental monitoring data that we can be confident.
What about the others, or what do they think at the moment about the monitoring?
I mean, we've got to be really careful we don't ask the wrong agency the right question.
That.
But the data agency is not here.
No, but is the data they're getting sufficient to what they need to do for the risk assessment?
The data, sorry, the question you're asking is the data they're getting today?
Yes, the current data.
Sufficient?
Yes.
Okay. Is that clear?
Yes. I can confirm that. I think that the data that we're getting today, based on the data and where the monitors have been located, is sufficient. And now that the current data is correctly calibrated and we have assurance of that, then yes, we're satisfied that we can continue to do our risk assessment, not a risk assessment based on that.
And just to add, I would agree with Richard that I think we would support keeping that monitoring equipment now for an ongoing period of time, because obviously we want to have ongoing data to be able to compare it to moving forward. So where the monitors are and the number, I think, is for a wider conversation. But yes, I think we would agree with Richard on that point.
Okay, thank you. Just in terms of that, Alango, you happy?
No, I just wanted to double check that we're okay now, going forward, and that hopefully we'll get more data that will mean something after we've got some feedback from the EA.
Can I just come in off the back of that debate? Because I note on page 9 of our pack, 7 of your report, that you talk about other equivalent longitudinal studies of impacts not being necessarily representative because there are too many other outside factors. I think that's probably my read of what it says. Are we into the territory now where we should be asking somebody, maybe the EA, to do some wider longitudinal studies to pick up, so that there is a body of evidence, particularly given the severity and the length of the impacts that have been felt by residents in that area? And sorry, go on, Alec.
Yes, no, completely agree with you, Chair, because once we recognised that there was an issue with the calibration equipment, we did a quick study, rapid review of current information that's available for hydrogen sulfide to see whether anything had changed in the most recent past, and there is very little data. There is a paucity of data. So I agree with the Chair. There is some need here to look at that, but again, where you would derive that data from to be representative to Wally's Quarry is one of the questions that would be within the scope of that, to try and understand, to get the right data to be able to compare it with this circumstance.
Okay, thank you. And obviously, knitting together the two answers to the last two questions, I think you would suggest that the monitoring equipment there would be the feed of the data long term alongside health data to be able to create that longitudinal study of health impacts in the community.
Yeah, absolutely. Any data that's available around a particular incident site is useful and very good data to be inputted into those studies. Yeah, absolutely.
Okay. And just final one for me at this moment on those similar areas. What is very striking, I mean, you mentioned, I think it was Richard maybe mentioned the different impacts on members of the same family, so people living in the same proximity. And I remember distinctly remember from our last conversations on Wally's Quarry that actually those people who are younger and their lungs aren't as fully developed have greater risk. And I think those people who've got pre-existing respiratory problems are also potentially a greater risk. Have you taken that into account in your risk assessments?
Yes, absolutely. So the standards that we compare to are sensitive to those that criteria. So it takes into consideration that there is a sensitivity within the population. And within those standards, there's also there is also a safety factor. But the moment you start to go above those standards, you're into degrading that safety factor, which is within the toxicology. So.
Yeah, thank you. And Richard, can I ask you, have you taken that into account in the assessments of the monitoring of the long-term health impacts? And you talked about a range of different studies that had gone down, looking at deaths, GP data, presentations of health issues. Have you sub-segmented those to try and identify specifically those areas that have potentially got greater risk?
So the moment the analysis that's been done has been all age. It's partly because picking out age-specific problems is even more difficult than doing it at population levels, because you start getting into some very small numbers. So if you can imagine that let's take hospitalizations, for example, the background rate of children being hospitalized, for example, for asthma is very low. So you'd have to increase that by many, many times in order to actually pick it up in the data. So the fact that you don't see it, again, does give you some assurance that there hasn't been a catastrophic effect, because it would appear. But again, it can't rule out a child or a class or even a whole school having been affected. It's just simply the mathematics of it. You just don't tend to see it at population level, given, for example, that let's take Royal Stoke Hospital serves the 500,000 people. So again, it's just trying to pick out that local effect in the context of a much wider effect is quite difficult.
Okay, thank you. Richard, we're with you.
Yeah, thank you, Chairman. For me, I think this is still a very major worry. And I say major is probably an understatement, because it's delivering with the unknown, isn't it? And what has occurred. Now, we could go on about why was the collaboration wrong and everything else. I'm worried about that in terms of my own experience of IOSH in terms of health and safety. And collaboration is quite important. And you have to set yourself the benchmark and everything else surrounding it, and to ensure that you're then measuring with proper effect. So it's a very worry that our elusive friends have just considered that as maybe an oversight and so forth. So I am still very disappointed about their absence. At the last meeting, however, I actually hit the question regarding in terms of the wider impact in the area. And so we're not just looking at a nearby situation, we're also where odour can be experienced further field. We now know that in itself is not going to have any bearing with the information provided. Is there any way that we can look at, you know, the going forward, working with, I suppose, the EA, the wider effects as well as the immediate effects in the area that we're experiencing? Because I think this is becoming a worry to the extent that, is it worse or is it not so bad? Or worse is a bad word. But it seems to me that this could be the tip of an iceberg.
Okay, where are you addressing that, Richard?
Well, it's collectively, in a sense, I suppose, the UK Health Agency and our own, Richard Harley.
That might be another interesting one for debate, actually. So but if you get beyond the health impacts, this issue at Wallis Quarry has potentially had all sorts of impacts on the local community. So there are reports, for example, that house prices might have been affected by it. There are reports that businesses may have been affected by it, so that their profits. There's people's mental health. There's community safety potentially. There's the reputation and perceptions of the area. One thing we might do is look at all of those in the round and try and understand what impact this has had on people over the last 3 to 5 years and how it's affected the whole community. I guess the potential downside of that, if you're someone who's been affected, is it might feel again like the authorities, I guess, sort of weighing the pig a bit, constantly describing the problems without necessarily having a solution that can make this go away completely and permanently. Because if I was a resident, that's what I'd want. So again, there's some potential upsides in terms of our intelligence, but possibly some downsides as well. Sorry, Katie, do you want to come in and add anything to what Richard has said?
I'm happy to come in, Katie.
Okay,
that helps.
thank you.
Yeah, just on the wider odour nuisance issues, there's obviously there remains a responsibility, both on the local authority as statutory nuisance as the competent authority to monitor for statutory nuisance, and on the regulated Environment Agency to investigate any odour complaints or reports. And that's to do a number of things, obviously to determine whether it's actually coming from Wallis Quarry in the first place, or whether it's coming from another source, because potentially over time there could be another source of nitrogen sulfide, or certainly an odour. So if there are concerns that complaints have increased wider than the current population, then I would think that is something for the regulators and the competent authorities to follow up. And we'd be more than happy to support any investigations into those if they were concerned about them.
Yeah, thank you for that. I think I am reassured that we are effectively got to look at the wider programme as well as the immediate programme.
Okay, let's pick that up in terms of recommendations from here. Jill, I'll bring you in a minute. I agreed to bring in Simon, so we'll take in sort of anyone who's got wider questions, given everyone's already been at least once. So Simon Tagg.
Thank you, Chair, and thank you again for coming to Newcastle today for this. Obviously, the Wallis Quarry sits in my division, obviously, so I'm acutely aware of the issues it's been causing for local people, and it's really good that you've come, and the health professionals as well have come in on this call. I think I echo your disappointment yet again that the Environment Agency haven't stepped up to the mark and come and answer questions, particularly as initially the question is going to be what went wrong, why did it go wrong, how long did it take to possibly give us obviously corrected information. Interesting to see now that has been pushed further back. We were promised that in November. We're hearing now meetings taking place in December. Will we hear anything this side of Christmas? I think my community are really keen to find out as much as they can, why the error was made, what the error was and what the corrected data will show for their peace of mind. I'll talk about mental health again, really, which we always have done this. That was one of the major side effects of this, is effect on people's mental health. One of the questions that came up was about the monitoring equipment. That's a question I raised at the recent liaison committee, and the Environment Agency promised to keep the 3 remaining monitoring stations there for the foreseeable future. So that's really encouraging. I think on the Health are saying we're getting the latest, the latest data now as they believe to be correct, and they can then start to offer advice going forward that they seem to be correct. I assume once we get the, if we get the recalibrated data, we'll be able to look backwards. But I think I'm just interested in this wider point that members have made, and something probably to ask Richard on this sort of wider impact. And not just the base health data who's linked to their GP, etc. There was a piece of work, I believe, that was going to be done in conjunction with Keele University that would look at that wider impact, possibly even interviewing local residents, interviewing local businesses, actually asking schools as well as GPs and the effect wider. Has that piece of work anywhere near completion, or is still in progress? I haven't really heard anything about it since it was originally muted. I think in the springtime, perhaps.
Yes, that's what I was referring to. Unfortunately, it wasn't possible to do it with Keele. We were just about ready to go to find someone else to do it when we ran into this latest round of problems. So we sort of paused it. It just didn't feel like an opportune moment. There is a question now about, I talked earlier about the upsides and potential downsides of that work. So it would be really useful to have a steer from this committee about whether that's something that you still think there's a lot of merit in doing, whether the timing is still right, or whether it might feel to local people like we're kind of shutting the stable door after the horse is bolted. You see what I mean?
I think with the issues with the monitoring equipment, I think people's faith in what authorities have been telling them for a number of years, dating back to 2017, I think is the most shocking bit of this, because the Environment Agency based its whole policy towards Wallace Quarry on the first monitoring that took place in 2017, which was an error, and then they stuck to that data going forward for many years before they started to take this seriously again when the real issues of odour started in end of 2020. But I think people would certainly appreciate that piece of work, I think, and to be asked as well, and to be involved in it. I think there's one thing the community don't feel as though from the side of looking into some of the problems that have been occurred by this, other than being asked to go to their GP, which is quite correct, or doing the symptom tracker, which I think was a really good piece of work that was done. I think this next part, this next step or study was going to take it further than the symptom tracker, and I certainly think it's something we should consider now, particularly as some of the data, particularly from the Environment Agency, seem to be sort of errorsome and not trustworthy. One last thing I would say, Chair, and then I'm done, is that let's not lose the wider picture here, that the operator is causing these problems. Yeah. And I think just remember the Environment Agency is the authority that can hold the operator to account for the permit. We have an abatement notice process, which the Borough Council is obviously involved in and monitoring very closely. But I think there are potential criminal investigations taking place. So the EA can't comment on that, why they're doing it, but that is taking a hell of a long time, and residents are very frustrated. Again, adding to the mental health issues around this as well, that people aren't being held to account as they see. So I think we've got to take that into account as well as we look forward. And I think this is long situation for the last couple of years, and it isn't over yet. And of course, we're entering a period now where we have more complaints around this type of year. More people are inconvenienced by the odours, and that's really been seen in the last week, where we have seen some spikes coming up and complaints rising, and social media, of course, is very sort of proactive on this to see what's happening in the locality as well. Thank you.
Okay, thank you. I think there's a lot of things in there, but I think it is not lost on me that at the moment there is no media or medium to scrutinise in an official way what happened, and that is a mistake in my view, because there is, in my view, a feeling that some of this is either being ignored or brushed under the carpet, and that is not appropriate, given the impact on individual health. So I think your point in relation to that, Simon, I think is well made. And actually, your point about speed of action, I think, is equally one which is made. It raises a question in my mind, however, which I wrote down earlier, which was, is it safe to still tip at Wallis Quarry? Has anyone asked that question?
In terms of your exposure at the point you're tipping?
Well, no, just, presumably some of this is adding to the problem. It's not resolving. Okay, we're back to the empty chair. Okay, thank you. Thanks for that answer. That's really enlightening. Some of you done? Yeah, Jill.
Right. Okay, makes your blood boil, doesn't it? I'm talking now with my mother's hat on, my grandmother's hat on, and as a granny, if I was living by that quarry, you just want to wrap your arms around your children and protect them. And I wonder if, and I know Simon, it's your ward, and I haven't been closely involved, but I've been following it. I just wonder if all those people who had an air of confidence about the dangers that had been raised, that they were being addressed, a confidence that they could perhaps rest a little bit and think, right, we're being looked after now. They're monitoring this very, very closely. We know that the health hazards have been reported, and we're relatively safe. Then suddenly, bang, we have this report that there's been, shall we call it incompetence? I won't say gross incompetence, but incompetence, that the measures that are being taken are not adequate. And today, for this, as Janice has told it, this empty chair present here in this room, it's an absolute failure that the Environment Agency have not turned up here today. And Chairman, you say, is it still safe to tip? With my mother's hat on, with my granny's hat on, no, it damn well isn't. We want assurances that at the moment, things are safe, that we don't have to be in panic mode and really think about our children and what's going to happen to them in the future. And I hope that we can take away from this meeting that there are going to be measures put into place, because it just isn't good enough. We're failing people within this borough.
So, Jill, I think you're talking about a lessons learned in part.
Yes, absolutely.
So I think that's a fair question just to ask the Health Security Agency as one of the partners in the wider chain. Is there planned a lessons learned and to ensure that this isn't happening elsewhere? Do you happen to know that?
Yeah, I would say we have limited information, but we are aware that there has been consideration from the EA as to whether this has impacted elsewhere. It's not something that I've got any detail about, but I am aware that work is going on. Don't know if Alec has anything else to add to that.
Can I just...
Yeah, that's correct.
Okay, thank you. Jill.
Yeah, and as a result of what's happened now, we're coming into the winter where our children bring home all sorts of germs, these little beasties that they collect, bless them. And parents are naturally going to be thinking, is this a direct result of what's been happening because they've not been monitoring properly, or is this just a common cold? You know, the mental health of parents, grandparents, carers must be really under pressure at this moment, dreading what's going to be brought to them.
Thank you. I don't think there was a question in there. So, Anne.
Thank you, Chairman. I'm looking at Newcastle Borough's complaint sheet, and on the 29th of October, we're talking this year, 150. I mean, it's sad that they're not here to answer the questions, because there's 115 complaints put in. And my question will be to the Environment Agency, what are the complaints? What do they consist of? What are the problems that people are still complaining about? But they're not here to answer it. And I think it's absolutely disgusting.
Yeah, I think we're sort of winding into EA territory, and that's
I know, but I'm sorry, I had to make that statement.
We should pick that up at the end of this meeting. And I think that's where we're going to. And just in terms of that data that you referred to, the 115 were complaints to the Environment Agency, and there was another 26 complaints to the Borough Council. And literally, you can see in June that there was 170 complaints to the Environment Agency at the end of June, and another 80 to the Borough Council. So, they're not small numbers, and it's clearly still ongoing. I think we're sort of winding to a conclusion in terms of the HSA. I've just got one question for you, please. Given that we haven't got the data, given that we're not going to see the data till the middle of January, and given Richard's and Alex's point that actually the data may not be transposable in any case, are there a number of scenarios that you've already worked up which says actually if the data says this, this is the impact? And could you not publish that framework in advance so that we see, actually if the number was consistently at X, or if the parameters were at a point, we could just literally be able to read off there and then, because you've probably done that work, I guess.
It's very difficult to do that, because that takes an assumption of just choosing a number. And do we choose times all the data by 3? Do we times all the data by 5? Do we don't times the numbers at all? So you get into these very arbitrary figures about, what's the worst case, what's not the worst case. So it's very difficult to do. I think what we want to do is wait to see what comes out of the work that the Chief Scientific Officer is doing, and then we will look at how we will take our risk assessment forward. I think there's some assurance in the data as it is today, based on new equipment, properly calibrated equipment, that, as Richard has mentioned earlier in the meeting, it's not far away from where the levels were previously. So we're not, huge differences in concentrations. But just to pick an arbitrary figure and do a risk assessment, because you're basing it on numbers then, is one that our toxicologists would find very difficult to do. So we will consider, options. I think we're going to wait until we get some data to start with, or an outcome from the meeting, and then we'll make a decision. But we're more than happy to report back to this committee how we will take that forward.
Thank you. And that raises two questions in my mind. The first one is, am I right in thinking the data today isn't publicly available from the properly calibrated monitoring stations? And if that's the case, I suppose there's a question for the EA, when is it going to be made available? And the second one is, if you were notionally in mid-January to get the revised data, and let's say it is translatable, how long do you think it would take you guys, who are usually very much on the ball, and we appreciate your input here today, how long will it take for you guys to turn around and be able to just update the risk assessment or do all that? Because there's, as you say, there's a lot of moving parts.
Yeah, I mean, we can update the risk assessment quite quickly, because say it's just numbers for us, and if we have numbers, we can work up that risk assessment very, very quickly. If there's a criteria for updating the numbers, which is within the responsibility of the Environment Agency, that might take their scientists a little bit of time to get the numbers and spreadsheets up to date. But certainly when we're given the spreadsheets and the numbers, we can make an assessment of that straight away.
Okay.
And what we would probably do is, rather than do, say, a risk assessment for whatever month it was in, we would do a risk assessment based on that data for that moment.
Thank you, that's helpful. And Philip.
Yeah, thanks, Sharon. I've sat very quietly listening while the questions have been going on, and the Environment Agency not being here hasn't really helped. But I think we're missing. Nobody said that these figures are lower than the figures that they had before. They're higher. And the last meeting that we had in Newcastle, I raised the question that obviously, with my farmer background, as you go out into the countryside, the odours and the hydrogen sulfide will dissipate. So by the time you get to the testing stations, it'll be one level. And by the time you get to a house, it'll be another level. And people's noses seem to have been a better detector of hydrogen sulfide than these faulty calibrated machines. But I've said at the last meeting, but when you get closer to the tip and the site where people are working, there's a health and safety issue. Because if you go to the levels that we've been reported, 9, 10, that is quite serious. That's 10 to 50 is quite serious. So as you get further up the scale, it becomes a matter of work and health at work. And I know that as a farmer, there are certain things you must not put your staff in danger of, and the place will be shut down immediately. So while we're castigating the Environment Agency, there's something about the Health and Safety Executive who should be investigating this site. The operators and criminal activity has been mentioned. The problem is that the operators of the site seem to be playing about 6 sides to the middle and got people running around about all sorts of things. As in a health scrutiny committee on public health, that's what we concentrate on, which is the public health of the residents of Simon's division and others, no doubt, who are affected by this site. There's property values. There's a whole host of other things that members have mentioned, but nobody's mentioned the health of the workers on site, who are definitely being put at higher risk than the residents. And I think on that basis alone, the minister's responsible, because there is a minister who looks the Environment Agency and the Health and Safety Executive, should be questioning what's happening at this site. And if necessary, it should be shut down until they come up with proper work practices and cap it, which is in the stuff that we've had over the weekend. It said it's not being done properly. Why not? So I think that while we're an important cog in the whole system, we're quite a small cog, and we need to alert these bigger cogs that they should be doing more to put pressure on the relevant part of this to get things done. We have our role to do, and I'm sure that Dr. Harding will pursue his role as Director of Public Health properly and assiduously, but there are others that really ought to be held to account on this, and I'm sure others will do. Maybe the Member of Parliament.
Thank you, Philip. Can we just pick up the employee point, because I think it's a really important one. Who wants to pick up the risk to employees on that site?
If I can just say that the remit for occupational health is clearly with the Health and Safety Executive. It's not the remit of UK HSA. So it would be for the HSA or the competent authority to look at any concerns of members of staff in that operation and see whether there's any concerns for their health. But we wouldn't be able to, we won't be able to monitor their health or go in under the site.
Okay, Philip, do you want to come back?
No, it is various departments, and I think that's one of the problems, Chairman, that we've got several departments doing things and saying that's not our responsibility, it's somebody else. And in the meantime, the operators of the site are carrying on.
It does
above my pay grade.
Yeah. I hear what you're saying. but it does strike me that we accept that there is a known health risk to those people who are within a circumference of the site. But actually, have we satisfied ourselves that somebody somewhere is doing something in terms of checking the health impacts on members of staff?
Have they done a proper risk assessment on site? Well, have they evaluated what the parts per million are on site? Have they taken that they have masks on? I don't know.
Yeah.
Have they got a full protective gear on lorry drivers that come on site? Do the lorry drivers remain within their cab while they're on site?
Yeah.
Is the man operating the bulldozer covering it up got protective equipment? We don't know. That is not for us to ask, actually. It's for another.
So I'm just trying to...
hoping that the workers on the site realise what risks they may or may not be taking.
And I think that now you've raised, and it's a really valid and important point, and I think we talked about it last time, didn't we? But is there someone from the... Sorry.
I think just to maybe assist members, I am aware that the enforcing authority for the health and safety is the health and safety executive for this site, and I am aware that they have been involved in multi-agency work in relation to this site. Can't say exactly in terms of the findings, but I know they have considered on-site health and risk assessments. Obviously, it would need to be that agency that could give those details, but to provide you with some reassurance, we have certainly contacted them as another agency involved in the site.
But they might, and I don't know, but they might have relied heavily on the data that the rest of us have relied heavily on, which now is flawed.
Potentially, as I say, I just wanted to make sure that members were aware that the health and safety executive have been engaged historically in relation to it.
Okay, thank you. That's helpful. Okay, I'm not seeing any further indications in terms of today's meeting, so I think there's a couple of things that we need to do to conclude. HSA colleagues, you're more than welcome to stay with us. You're more than welcome to leave us. But before you do, I did want to just say thank you for your candour, thank you for your honesty, thank you for your transparency, and thank you for your attendance. Because without all of those, we would be none the wiser. So thank you for that. And I'm sure as soon as you've got something to report to us, please, can I encourage you just to drop us maybe a file note, which we can send round committee. I would not want to lose months trying to find a slot in a diary for any further updates, because I'm sure that we would want to make sure that that was shared as widely as we possibly could. So please stay with us if you want to. There's two things that is left for us to do, I think, today. First of all, are committee minded to do anything about the non-attendance of certain parties today?
Yes. Yeah. If I may, I think that it's absolutely critical that we have a, first of all, we mentioned about sharing the documentation, and I would like to see that for sure. But we definitely need to have a mechanism whereby the questions that I prepared before I set off from Lichfield, an hour and 20 minutes drive away, we have opportunity to present those, because we need to have that confidence ourselves that what has been done isn't happening elsewhere. And we need to get those material facts to make sure that we are assured, and then obviously the residents of those who represent here can also be assured that it's not going to happen again, whether it's just here or whether it's of a wider base. So I think a mechanism to be able to do that and quickly is absolutely critical.
Understand, thank you. So we could potentially draft a list of questions to send to the EA, or would you prefer to send them to?
In fact, we might need to think about the fact that when we see the documentation, so if we've had no reply whatsoever, then actually I think we need to take it to the next level up and present the questions then.
Okay, so given we've already written to the Secretary of State for the Environment, the previous Secretary of State for the Environment, and the Minister responsible, are you suggesting that we take this down a health route? Is that where you're going?
Yeah, because it is the health, it's the physical and the mental health of those people who are living in the area that is paramount, and I think we need to have some answers on that for sure.
So I
can't get it from anywhere else, then we need to try somewhere now.
So I don't remember the last time that this committee referred directly to the Secretary of State for Health. Is that a view, it's a very sparing power that we should use? Is that the view of sorry, can I just bring in Rich?
Sorry, I think you would have to check whether you have that power in relation to the Environment Agency. I believe the regulations that you've got the power to refer NHS decisions up to the Secretary of State, but whether the Environment Agency falls within the purview, I'm not sure.
Do you think the environment? Do you think the Secretary of State will know that?
If they're watching.
Do you think we should at least present the case?
Nothing to stop you writing and presenting the case. It's whether you're presenting it in the context of a formal referral to the Secretary of State that I think you need to check that your powers gave you authority to do that.
Okay.
And I think, to be fair, we also need something to be able to refer to. And if we haven't had any communication, then it's really a little bit challenging to do that as well. So I just think I would be content that we present a list of questions. I certainly have some. I'm assuming that colleagues would have as well. that we get the opportunity to present those to somebody in the hope that we will actually get a reply this time. And I'm assuming we give them sufficient time to be able to reply. You know, they from what was already being done, so that would be useful just to the documentation that we've sent already.
Okay, understand that. So how do the rest of the committee feel? Sorry, you're not on committee.
Can I just say, as the ward councillor, Borough Council, I'm amazed that that step hasn't been taken already.
Which step? Sorry, which
It is a public health matter and it hasn't been. I know it's been raised with Therese Coffey, the former environment, but not being taken forward as a public health issue.
Yeah. I
can appreciate colleagues saying that this could be some technical issues with that.
I mean, without going into long debate, and because it's not for this forum in some ways, we should only refer to the Secretary of State items that are things that we don't feel there is sufficient movement or progression on, and it is a power that is used extraordinarily lightly in all upper tier authorities with health scrutiny committees. So which is why we haven't done that, because if we give them a letter every week, it sort of dents the impact, unfortunately.
These are issues going back to 2017, aren't they?
I think the bit which is sorry, I won't get into a debate on this. So let me just guillotine, but I'll give you the answer, which is we've discussed this at this committee a number of times. But the data that we used to form our opinion and from the expert witnesses was proven to be flawed, and hence that's the reason why we're back here today. I'm not going to bring you in, Simon. I'm going to try and get to the recommendations so that we can get to a conclusion. So Janice has proposed that we write to the Environment Agency with our questions at a senior level, presumably chief exec level. I've not seen any alternative proposals, so are we all in favour of doing that?
Yes, definitely.
Okay, so how about the questions then? Or are we going to suggest creating a list that goes by close of play tomorrow and we just submit them on email? Is that an easier way of doing it?
So there's notes been taken through the meeting as well, the various questions.
I'm not promising to get the notes done for tomorrow.
No, but the questions might be highlighted out.
I can certainly email my questions over before I leave today, because I've already got them ready. Right. I'm very disappointed that I haven't had an opportunity to present them.
I have a very similar list of questions that I would like to have known the answer to. So maybe if you can send them to me this evening, and then if you send them to me, I'll circulate them around those in committee who have been here, and then first thing in the morning. So can I ask that members look on their inboxes first thing in the morning, and then give us a response by close of play tomorrow night, and then Zach will send that through to the chief exec of the Environment Agency. Keith.
I think we also need to put down on something about the outcome of the meeting that has been proposed, which we're not going to be part of, but the health authorities are, in December. So an output from that meeting, we need to be asked to be presented to the committee as soon as it's available, I would have thought.
Yeah, and I think that's what we've probably finished asking the HSA for as well.
That, just make sure that
we don't want to be in the process. We want to be monitoring the outcome of the process.
Yeah, well, at least some of our questions could be answered in that process as well. Certainly some of mine.
I think there will be another opportunity maybe once we understand the data to be able to have that discussion. I'm hoping at least.
Okay.
But I don't think it's December. I think it's January. We need to have what does the data tell the HSA? What's the HSA's?
No, I was going to say, can we not just have the HSA going to interpret it and look at it and everything else? Why can't we just get a copy of the outcome from that meeting in December?
I'm not sure.
Whether we're allowed to or not.
I think we'll be at danger of interpreting stuff that we don't know anything about. And I think we need to let the subject matter experts do the interpretation, which is why I asked the question at the end I did of the HSA.
Well, if the Environment Agency is getting it, they appear to have just as many skills as we have, which is virtually none. To be able to analyse their own output from their own data. So
maybe I should just.
I'm arguing a case with you now. So sorry about that.
I just want to just sort of be careful on the language. So let me just take in Philip and see where we get to.
Yeah. Apologies for the little outburst of music from my laptop, but I was looking at a video that the Environment Agency, if you do about 5 clicks through the email that Zach sent us this morning with links to other things and then links to other things and links to other things, comment about such late information to a committee. That's not on. And the other bit is, and the stuff that they put out on the 16th, if you really drill down into it, the catabactic effect that's coming with the winter will mean that the residents of Simon's division will have more smells as it gets colder and stiller over the coming months through the winter. And they need to, not a technical term, pull the finger out.
Is that a little bit like silage making, how the smell gets stronger and stronger to
No,
the winter?
it's a weather condition. It's nothing to do with the smell. It's to do with the weather conditions, the coldness of the ground,
in relation to the
stillness
hot
of the air, so that the smell hangs close to the
We used to
ground.
call them smogs.
It's catabactic.
Thank you.
Yes.
Thank you for explaining that.
I'm sure Richard will find that
Yes.
interesting.
They used to be called smogs.
Oh, thank you.
Okay, Janice.
Yeah, it was just to pick up, Chair, you might already have it down as an item. Dr. Harlin mentioned earlier on for us from the committee.
Yeah, I'm coming on to
I didn't
that.
want to miss my chance.
No, not necessarily.
All of a sudden, is it?
No, I was trying to cover one at a time, and then we can.
Fine. I'll come back in when you're ready.
Are we happy with the process to go forwards in terms of questions to the EA?
Yes.
First thing tomorrow, close of play,
Yes.
guillotine tomorrow night, and then submitted first thing Wednesday.
We're going to ask them why they didn't come, aren't we?
They've laid it out the minister has laid it out, and maybe the exchanges of correspondence is the place to identify that. Okay, so just following up where Janice was going to, there were a number of recommendations that came out of today's discussions. One was to redo the analysis of the community impact. There was a subsection to maybe widen the analysis to look at a range of other factors. What do committee feel about that proposal?
Yes. The new analysis is definitely needed if it can be done.
Yes, but we're now talking about community analysis, aren't we? We're talking about the bit that Richard was talking about in terms of starting at population health level and then moving into checking out the GP, checking out the health data, and then engaging with people, which was Simon's point, engaging with people to actually get their perceptions from the ground. And then linking that back into, some of the wider environmental factors that Richard talked about, like house prices and impact on business and those sorts of things. So are we recommending as a health committee that Richard and Public Health do that?
Absolutely.
Is the time right? I think you indicated doing the thing.
I think the question was, A, should we do it, and B, should we do it now?
Yes.
And I think that was what prompted my question prior to that, was about what's already been done. If it was last autumn, are we giving ourselves a sufficient amount of time to be able to measure what would have maybe come into more of an effect now than what it had done previously? But I think we really must collect our own data as well to be able to support where we're at the moment.
So I didn't see any dissenters in terms of should we do it. I think that's right. And the only real question is when. Have you any recommendations, Richard? Are you thinking about doing it when there's greater clarity around the data, maybe in January, or are you saying no? That there is a possibility we might have less clarity.
So it's partly about the clarity around the data, but also, I guess, from the perspective of residents. Are they going to find it helpful being asked these questions, or is that just going to, I don't know, sort of exacerbate their suffering and just raise the issues when it is not clear that we've got a permanent solution ready, I suppose. So there might be some benefits. There's also some potential risks for people, and it's really just that balanced judgment to make sure that whatever we do is going to add value and not do too much harm.
I think if we don't do that, residents are going to be saying, well, why haven't they come back to us? Why haven't they asked us the question?
I think, if I may, Chair, I think some of that also impinges on some of the pertinent questions that we've been putting over. How long is it going to take before we do have that clarity? So I think the outcome of the December meeting, January meeting, whenever, that will be able to give us some more information that then I think we need to handle the message very carefully when we do go out to the residents, that we're wanting to find out about their situation, rather than actually make them more concerned unnecessarily, potentially. So that's why I think those dates are also really important, that we know when it is going to be able to, if ever, but at least then we'll know it's a conclusion, to be able then to go back. But I do think that we need our own information and our own data.
So is that the view of committee?
I think so, yeah.
Okay, Richard, you have a really clear steer, thank you. And next recommendation was to recommend that the ongoing monitoring of the monitoring stations are there for the foreseeable future.
I think they've already said that we're going to be, so that's all.
But I think we should make it as a recommendation. Are we in agreement?
No.
And then the other one we talked about was the longitudinal study in terms of the long-term health impacts, given the paucity of current studies. And we can decide whether we make a recommendation that the EA should pay for this, given that part of this is a direct cause of miscalibrating the equipment. Are we in favour of that recommendation? Okay, and the final one was Phillips, which was relating to the HSE, not the HSA, the HSE. In terms of maybe just highlighting to them maybe our continued concerns about the impact of people working on site, and then leaving them to decide how they want to take that further forward. Are we in agreement?
Agreed.
Good. I think that makes things nice and clear. Thank you for your engagement today. Thank you for fighting the traffic, and I'm sure this will come back up again. So at 2:25 I will close the meeting. Thank you.
Catch it back.
Yes.